Thank you for joining us today. This is September 11th. Our 1 o'clock agenda will be the Hawaii State Council on Developmental Disabilities, and our Senate COVID committee will also hear from Department of Education during that time. At 2:30, we have the Department of Health. Before we ask for comments from Deborah Kobayakawa of Hawaii State Council on Developmental Disabilities.
Madam Chair, if I may.
We recognize Senator Donna Padukin.
Madam Chair, I believe that this committee should be making a statement of our concern regarding what is going on at the Department of Health. Today's newspaper said there's a toxic culture of fear. As we all know, we met with Dr. Jennifer Smith and found out exactly the number of contact tracers and the concerns there, which prompted our visit to the Department of Health. And for her to be put on leave and for her to be threatened and so forth, because she did come out to tell us exactly what was going on, I think is a travesty at this point. And I believe we should be calling upon the administration to deal with this immediately. She shouldn't have to fight this in a court of law. We do have a whistleblower law that protects people from that, and it sends a very bad message across this state that if you bring out or criticize what is going on, that you're going to be put on leave or lose your job.
Thank you, Senator Kim. Any comments?
I'd like to just echo what Senator Kim said, is that we would like, we have a pandemic. We are looking at Department of Health to lead us, and if people can't come forward, staff who have been involved can't come forward and tell us how we can do this better and solve this problem, we're all in bad shape. So I would like us to be on the record as the COVID committee supporting that what Senator Kim is saying is the governor should intervene and bring the staff back to Department of Health to serve the people of the state.
Thank you. Frankly, I also think that had it not been for Jennifer and her courage, we still would be having 3-digit cases in the 300 numbers and higher. Who knows how many more people would have succumbed to COVID-19. I don't know that the U.S. Surgeon General would have come down and tried to help us the way that they have helped in the past week or so. And I owe Jennifer a gratitude of thanks for coming forward and giving us the reality of the turmoil that DOH was in. And all along we doubted that they were up at 105 contact tracers, as we were being told for months. And to find out the hard truth was something that took very much courage. And I truly, truly thank Jennifer for it, because she has probably saved many, many lives. And I think that this committee may want to put this in action by doing a letter to the governor and asking him to intervene, use the whistleblower's law, and bring Jennifer back to her duty station. Senator Favela?
You know, I echo everything everybody's saying here. You know, the sad part about it is, you know, when we hear the word whistleblower, you know, people get a negative take on this. But for me, I don't think she was a whistleblower, because we had asked in public, on TV, numerous of times of transparency for government. And Jennifer took it upon herself to come here knowing the repercussions that she might take and have effect that is happening now. That is sad. That is sad, because for the people out there that is listening, we should be very thankful that she came forward, because of all the things that happened after that. Like Senator Donna said and Senator Michelle, these things that would never have happened if somebody would not come and shed the light. So I don't look at it as a whistleblower. I'm just seeing somebody that was concerned just like us and giving us great information. And having that great information was us go forward to not only do our jobs, but be transparent to the community and the people out there that was asking the hard questions. So I totally support us writing a letter to the governor and reinstating and giving her back her well-done, the deserved job, and the job that she was doing well done over there when she was overwhelmed with over 100-something cases. So again, I echo the same thing of our senators here today, that we should go forward in writing the letter and letting our governor know on our concern, and we need his assistance to rule in the favor and on taking care of somebody that helped, like how Senator Michelle said, she saved, without her even knowing what she is coming forward, on the lives that she are going to be saving now and in the future by having this information come out to us. And I thank her for that. And I wish her the best, and we'll do whatever we can to help her out too. Thank you.
May I also add that when Jennifer did come before us, she did raise concerns. She was told not to speak to the media, not to speak to any of us, and they were sort of threatened that they shouldn't do this. And because she did it, this isn't a directly related, although they've said it's because she threatened and she has a gun. I find that hard to believe, having met with her, that those charges are valid charges at this point in time. And to hide behind the fact that this is a personnel issue and that they won't comment, again, to me is a travesty to our laws and a slap in our faces.
Thank you. Thank you for that. Okay, we will start our conversation with Deborah Kobayakawa, Chair of the Hawaii State Council on Developmental Disabilities. Deborah, please proceed.
Thank you so much. Chair Dela Cruz, Senator Kidani, and committee members. Thank you for this opportunity to address concerns regarding special education within the Hawaii Department of Education. My name is Deborah Kobayakawa, and I was appointed by the governor to be on the board of the Hawaii State Council on Developmental Disabilities, and the board has recently elected me as their chair. I'm also the parent of a 30-year-old son with autism and intellectual disabilities. I'm a former special education teacher for the Hawaii Department of Education, and I currently run and co-facilitate parent support groups here on the Windward side. I am here today representing the Hawaii State Council on Developmental Disabilities. And I just wanted to preface the written statement that we submitted with the following. I am here today to help support the Hawaii Department of Education by bringing this information to light so that things that are not working statewide can be addressed. We know that the Hawaii Department of Education is trying to support students with disabilities, and we have met with Hawaii Department of Education. We have shared our communication, information, and parent concerns with them. The issue is really consistent implementation statewide for all schools, families, and students. For the past 5 months, we've heard from over 100 parents and or caregivers regarding the lack of information and supports from the Hawaii DOE for their child with a disability. There's also a lot of confusion regarding information and procedures in place for special education. At this time, I know that we've provided to you in writing some of the concerns along with questions. So would you like me to go over them at this time, or how would you like me to proceed?
Are you referring to the questions in the letter dated today?
Yes.
Yeah, I think, I don't think that it's fair to ask the questions that they're not going to be prepared for, Deborah. So what I would like to do is to give the department some time to respond on those questions, as they have not had the opportunity to see them. I don't know if you sent them directly, because we didn't receive this at all until this morning, actually right before I got here.
It was sent out to Mary. I emailed it to her yesterday around 2:30. That's the person that contacted me. I think it's Mary Dean.
Perhaps she could at least just go over the questions so the public knows what it is they were asking, and that
Sure.
hopefully we'll get that information.
Okay, sure. And then, so, the Department of Education will get this and then respond at a later time or in writing, okay? Go ahead.
Thank you. So some of the concerns is timely information So parents are not receiving the crucial information they need to understand the various models of education and instruction being offered to students during this time in a timely manner. Parents and caregivers have voiced concerns about the lack of transparency from the Hawaii Department of Education, mainly regarding new policies and procedures for students with disabilities since school closures in March. So some of those questions are, how will timely dissemination of materials be provided to families? What is the Hawaii Department of Education's timeline assuring parents and caregivers that they receive necessary information to have meaningful participation in their child's education plan? And is there a plan in place to offer any parent training? And if so, what might that timeline be? And who would be providing it? And then the next area of concern was infographics. And we know that those have been recently put out on the website on September 8th. And those infographics do help support parents with the information they need to make informed choices. But some of the questions are, how are we reaching parents and caregivers with this information other than digitally? And when will printed materials be made available, and or if any translated versions, in other languages, and accessible infographics. So we know there's not a large number of parents that have a visual impairment or disability, but that's probably something in consideration. And then what type of a system is in place to ensure that all parents and caregivers have received the crucial information in these infographics? There's also concerns for clarification and understanding for the Hawaii Department of Education to be aligned with its mission to ensure that all students reach their aspirations and that the department is student-centered. In their decision-making, we need clarification and understanding of the education and instructional model options available to special education students. There has been widely varying and inconsistent models of both by the Department of Education. And some of the questions are, why has the department not gone with a consistent education option and instructional model statewide? Allowing each individual school to choose their own options is causing great confusion for a lot of parents. Often they'll have children that attend different schools, and it makes it really difficult for parents and caregivers to understand. Some examples are the 100% distance learning has different meanings at different schools, and some of those schools are in the same school districts. Families have been getting letters sent out to them stating if they choose a distance learning model, they're opting out of special education, that IEPs can't be fully implemented. And I know that I've seen other documents coming out of OSIS and other places that it's a mixed message, we think, for a lot of families. And there's even been an example of a school that sent out as one of their education options, so distance learning hybrid model, or signing a Form 4140 and withdrawing the student from public school, which caused great concern for that family. It is our position this option should never ever be used when discussing choices for a student in special education. Students and caregivers are also being asked to attend meetings to discuss things like distance learning plans and contingency plans, but they don't have the information given to them. Parents and caregivers are expected to also address the impact COVID-19 has had on their child's education without knowing that their input from working with their child at home is supposed to be used in this determination, or that they should even be gathering information. And then technology, and we know that this has been something that's the state's working on, but we haven't heard from any single parent or caregiver stating that they've received the necessary training and technology from the department to support their child's distance learning. Many special education students are in fact being cared for by grandparents who may have no knowledge of technology, and parents and caregivers may only have a device instead of a computer, making it difficult to access the various virtual learning platforms. So some of the questions that we have are, how will the Hawaii Department of Education be addressing the overall lack of technology, connectivity, and internet speed? And where are the numbers for how many special education students have the necessary technology for distance learning? We know that some surveys were conducted earlier this year, but those were a digital survey. And how will students who live in rural areas without internet service be accessing their education? We're more than halfway done with the first quarter already of the school year. And then what about the students who are not able to participate in distance learning? How will their IEPs and education be provided to them? Some districts, we recognize, are implementing plans to the best of their ability, and we know that people are working really, really hard in the field, but there is no consistency. And the bigger question is, how is the Department of Education going to address the inconsistency? Often we hear from parents or caregivers if they have a concern and they ask the school, they're often given the answer, they're not sure, they don't know, leaving parents on their own. If parents do try to network, they often can't help each other because each school is different. There's no consistency or standardized helpline that can support parents and caregivers who are the ones bearing the brunt of supporting the child's learning at home. This could also include learning accommodations and behavioral supports, things that the IEP team has determined are necessary for the student to access their education. And this can be really difficult for families and caregivers. And then parents are being asked to participate in meetings with their schools when they may not have access to the technology or connectivity, because we know we can't do any in person. So in summary, parents and caregivers are reporting kind of a total disconnect, if you will, at this very stressful time. Having a child at home with special needs 24/7 and then having to function as both parent and teacher is a totally new experience, and most parents we've talked to report that they do not feel equipped to do this. And that's all we have.
Thank you for that presentation, Deborah. Members,
Thank
any
you.
questions? Do you have any questions? Deborah, do you guys have monthly meetings with other groups and the Department of Education related to our special education students' needs?
We currently don't have any set up scheduled meetings, but we would be more than happy to work on doing that. We have met with the folks at the Office of Student Support Systems.
Okay, yeah, so I thought that there was a group that met regularly, and maybe we'll turn it over to Department of Education Assistant Superintendent Heidi Armstrong, and maybe she can clarify some of that in her presentation. Heidi, are you there?
Hi, yes, I'm here. I had a PowerPoint to share that you've received from our SEAC meeting this morning. I'm going to just briefly skim through parts of that, and then I'm going to share the second attachment that all of you should have in front of you that talks about our meetings. And I'm not sure we're all on the same page because I have several meetings, our quarterly meetings with our office having the representation on the State Council on Developmental Disabilities. So there's some either misinformation or a disconnect, and I'll get to that in a few minutes. But good afternoon, everybody. My name is Heidi Armstrong, and I'm the Assistant Superintendent, Office of Student Support Services. And I received a different letter that I was CC'd on rather than the one that was just shared. The letter was sent to several senators and representatives, but it informed me of very broad concerns with the current situation in special education and the Department of Education. So the concerns were lack of transparency and parents not receiving the information that they needed. Some of that was just shared. We do meet regularly with many of our parent councils and advocacy groups, and I'll get to that. But I'd like to preface it that we also sit on the Council on Developmental Disabilities, and when we hear of cases, we're not perfect by any means, and we're trying to navigate through this pandemic, and we're constantly course correcting. And we'll continue to do that, and we're committed to doing that. But broad concerns like this, it's very difficult to solve the issues that the parents are experiencing. These issues were not brought up from our representatives sitting on the Council of Developmental Disability Meetings. So the hundreds of complaints that they've received, it'd be appreciated if we could address these at the meetings, get to know the family, the school, so that we can course correct if course corrections need to happen. Rather than having those parents share their concerns with a specific group, but not letting us know the who and the where so that we can address them, because we are committed to doing that. So we do welcome a partnership. We welcome information like this, and we do want our parents to feel supported, and we do want our students to be successful. So I'm going to start off just with a very annotated presentation that we gave this morning to one of our partner groups, the Special Education Advisory Council, and I'm not sure if you, can you see?
Yes.
A PowerPoint in front of you? Okay. Can you still see a PowerPoint in front of you?
We can, and we also have copies in front of us too.
Okay, terrific. So this presentation, it wasn't created due to the letter that I received on September 9th, but these are planned presentations. We work with our partners in SEAC and plan presentations a month in advance, so this was prepared a while ago. But the agenda included 5 large topics that SEAC representatives wanted more information on, and what's possibly relevant to today's conversation are the first 2 bullets, the overview of the COVID-19 impact services and the review of the current instructional models. Now we have parent representatives on here from all islands. We have LADA, our partner, we have SPIN, our Special Education Parent Informational Network. So our outreach, we have our Children's Community Council, and then just concerned or interested parents and community members. So we try and share this out as much as possible. So starting off with the information, giving this parent group and special education support group a broad overview. On August 27th, 2020, the department announced that it will continue the learn from home phase of distance learning for most of students statewide through the first quarter, which ends on October 2nd, 2020. And schools will also continue the educational programming for vulnerable students to include students with IEPs when special education and/or related services cannot be provided during distance learning. So to answer one of the previous questions, we are committed, and we've brought back hundreds and hundreds of students to face-to-face learning, practicing all of the health and safety guidelines that we can. We know some of our students struggle with that, and we have provisions in place, but we're not expecting all of our special education students to receive their students via distance learning, because we know for many of our students, the IEP goals and objectives cannot be met during that, by that instruction. Continuing on September 1st, 2020, the State Special Education Department, which is us, issued a memo entitled Specially Designed Instruction and Distance Learning for Students with Disabilities. And so this is information and training and supports that go to teachers, which clarify and provide guidance to schools, reminding schools that in order to provide a free and appropriate education, it's necessary for specially designed instruction to be developed, whether the student is accessing their education via distance learning or in an in-person model. We're also recognize the need to provide more guidance on homebound instruction for our more vulnerable students, where the IEP team has determined servicing in the home is the best placement for the child at that time. And so, as I say, we're continually improving. We recognize that need. A memo is being drafted. It's almost ready for release, but that's coming, and that's how we're constantly course correcting as we receive the productive feedback that helps guide us in providing better services for our students. We also have just established, due to an ask of our teachers, a professional learning network that's going to meet monthly for our teachers who are servicing students with more significant needs. And typically these students are in a fully self-contained classroom. And so at these meetings, the teachers will be able to share what is working for them, what they need assistance with, what are the ways that they're communicating and communicating to and engaging with their parents. And so we're setting up these networks to support the concerns that come our way. And so I want to go back to my original statement. The blanket concerns where everything doom and gloom and the department hasn't done anything, it's not helpful. But specific instances where something, a situation happened that may need course correcting, bring it to our attention, and we'll see what additional structures and supports we need to put in place, not only to correct that situation, but to hopefully prevent it from happening in other instances as well. I'm going to go quickly to the next slide. Our message has been clear and consistent, and it remains the same, that during this time of distance learning, all schools must implement each student's IEP and provide special education related services and specially designed instruction. Even for the students whose parents opt in for total distance learning, and that would mean that the school and the IEP team may have shared that the student would benefit most from an in-person type of setting in order to meet all of the goals and objectives. Some of our parents might want to choose to keep their students home at this time. And so a meeting is set up to share with the parent what can be delivered via distance learning for that child and what services might not be able to be delivered due to the choice that the parent made to keep their child at home. Students who do need services that cannot be provided at home are always welcome back on campus, and we're ready and prepared to serve them. We also shared with our parent community group this morning our current instructional models. And before I go over this, I'd really like to give thanks again to Special Education Parent Informational Network and SEAC and our Office of Curriculum and Instruction upstairs for all working together to bring to light what definitions need clarification, not only within the department, but also that parents can understand it better as well. And so you'll see on here, we did go over, and I'm not going to go over it now, the different models of learning that are taking place right now, and then what those terms mean. What does it mean to be in a distance learning model? What does it mean to be in a face-to-face model, etc. We also shared the definitions of synchronous and asynchronous learning that has caused confusion with many of our families. And so we work with our networks and our partners to have common definitions. So as we spread the word and as we work with our families, our partner groups can also do the same. And there was about 30 slides to this, but those were some highlights of what was presented this morning. And now I'm going to pull up the other document that you have in front of you. Does everybody have this document in front of them?
No. Go ahead, Heidi.
Okay, so this was these were the concerns that were sent to the letter to me, not the letter that was shared at the beginning, but the letter that I received on September 9th. And the concern was, we are writing to inform you about the lack of transparency regarding students with disabilities And so what we did is we looked at what have we done, because we take, even though it's a broad concern, we take it seriously. So we look back, what have we done? And in the Exceptional Support Office, which falls under the Office of Student Support Services, we do have our parent partnership meetings in which members of LEDA, which is our Leadership in Disabilities and Achievement in Hawaii, our Special Education Parent Information Network, SEAC that I've mentioned before, Children's Community Council, and we put down what meetings that we've had with these parent groups and the topics of what were discussed in those meetings. So you can see they started well before the pandemic, but they also continued at the beginning of the pandemic and beyond. And you can read that on your own as to the different topics that are covered, trying to get out the information statewide to a broader audience of what is going on.
Heidi, I don't see the State Council on Developmental Disabilities as part of this group. Are they welcome to join, to be included?
Absolutely, absolutely.
Thank you.
I also want to share that LEDA, which is our, and I want to get the acronym correct again, the Leadership in Disabilities and Achievement in Hawaii, it is a US DOE funded organization charged with providing parent training and information centers of families with students with special needs. And it's a competitive grant award. Each grant award lasts for 5 years. And during this time, LEDA is our agency charged with working with the department in helping with effective parent support and communication. When you get your electronic version of this sheet, you can also look at these links here because we're very transparent about our memos that go out, the communication that's available for parents, the communication that's available for the schools, and many of our partner organizations, including SPIN and SEAC, have posted all of this information on their website as well. We don't want our information to stay within our department. We want to get it out, and if you go to those sites, you will see the sharing that has been done from the department with these agencies. We also attend monthly meetings with SEAC, and the presentation, the PowerPoint that I just shared, was one of our monthly presentations. Usually the Department of Education has a presentation every month based on the questions or concerns that members of this SEAC or participants in these SEAC meetings have. And so we're very open to support that. And the partnership that we have with them is second to none, and I'm very appreciative for that. They're a great help to us. We also have the quarterly Children's Community Council meetings, and following that, our office has a representative on the council, State Council on Developmental Disabilities. So I'm not sure, when the question was asked at the beginning, you know, are there meetings, et cetera, and we attend meetings there. So meetings for that do exist unless we're talking apples and oranges. We have a representative on there not only to contribute, but also to be the big ears to see what are concerns that are being brought up so that we can help to address them. And the hundreds of concerns that were shared were not shared at any of these meetings. And so if the council, I'd appreciate it if the council would bring those up at the committee meetings or meet with us individually so that we can assist these families who have the issues that were shared at the beginning of this session. We also have ongoing meetings with our contracted providers who are also outside of the department. We meet with them monthly, and many times they call us in for meetings in between those monthly meetings. You can see the list of meetings there. Our Hawaii Department of Education website has a wealth of information. A lot of that is listed here. And we do recognize the concern, and this is a problem we're addressing, and we haven't solved it, okay? But for parents who don't have access to technology, how else can we help get them the information? One is through our partnerships with our other agencies. Two is how do we determine what information we need to ensure we get hard copy to these parents who don't have access. The infographics that were mentioned both by the Council on Developmental Disabilities that were created by SPIN and SEAC are wonderful. The topics of those infographics, and I wrote them down, I don't have it in front of me, but include terminology, include how do you have virtual IEP meetings, it includes what does special education mean in distance learning, etc. So we currently have a memo that is going to go to the field within the next week that is going to ask all teachers to disseminate all of these 9 pandemic infographics, and there's more on the SPIN and SEAC website, but those dealing with the pandemic at the IEP meetings that are taking place this first quarter. All special education students should be having an IEP meeting within this first quarter to address the situation that we're in, to talk about their learning plan, to relook at the goals and objectives. The meetings might go a little bit into second quarter, but if that being, we can give hard copies of this information to all parents then. We know many meetings have taken place already, and we'll be asking the schools in that memo to ensure that those families who've already had their IEP meeting also get this information hard copy if that's the best mode of delivery for them. Going down on this list, the training that we've given to complex areas in schools, I'm just going to pull this link here to give you just a quick look. These are the meetings since the pandemic started that have been Neighbor Islands, Oahu. The district educational specialists lead these with the Office of Student Support Services help. You can see the list of areas here and then the topics that are covered in these meetings on the right-hand column. We continually update this link and it's available there for your purview if you so choose. We also hear, and I'll agree with some of the statements that were made, information is constantly changing and we need to continue to talk and ask our questions so that we have similar information from the Windward side being distributed to the Honolulu side to the Kauai side. And so I sit on the complex area superintendent's leadership team, and I listened to the conversation, and in the past couple of weeks, there were many questions having to do with special education from our school leaders. So the Office of Student Support Services had a meeting, no agenda. It was just a question and answer where every complex area had an elementary, a middle, and a high school principal representative to have everyone from the Office of Student Support Services, Special Education's branch, undivided attention to ask their questions that were pressing on them right now, because we know schools do need our support as well. So when you get your hard copy, that question and answer is available for your purview as well. We did have a meeting with the DD Council on August 25th, where the DD Council shared their concerns, not all the concerns that were brought up at the 4th, but from the letter that I had. And we continued working with members of that council on the 26th. You'll see here on the 28th, on September 1st, 2nd, and 8th. So the maybe within the council, the communication is not being shared, but when they came to us, unaware of some of the information that was out there, but we do know that the Council for Developmental Disabilities also sits in the SEAC meetings where this information has been shared for months. So it could be a communication issue. We have them, I recognize them, and that there is a disconnect there because we have been meeting with them. And that's just some of the information to share with you on what the Office of Student Support Services is doing to address the concerns. We always continue to improve, and we welcome the constructive feedback, and we appreciate the constructive feedback, but I would appreciate it in a timely, relevant manner, rather than letters being sent to all of our legislators when we haven't even had a discussion with the author. And I'm open for any questions.
Thank you. Members, any questions on the presentations yet? Heidi, thank you for that. I think what I want to make sure is, number one, that you will get a copy of the letter that we received today from Deborah of the Hawaii, the State Council on Developmental Disabilities. And there are some questions in there that may have been answered in your presentation, but we'll be sure to send you a copy of that. And I would suggest that it seems that you are having regular meetings, and that if they are not present, to make sure that they have a list of meeting dates. And I think what it looks like is you have several different groups, but whether or not they're able to attend all these meetings is, I guess, something that you need to let Deborah know. Deborah, are you still there? Do you have any questions?
Yes, I'm still here. I just wanted to clarify, if I may, DD Council meets every other month, and so our next meeting is at the end of September. That'll be on the 28th.
Okay, but Assistant Superintendent Armstrong pointed out some of the other meetings that they have that are open to you, and I've asked her to make sure that you get a list of them so that you know you're invited to some of these things, and maybe some of the discussion that is presented there will also help you. So I will be sending
Absolutely.
your letter to her so she can respond to the questions there.
Thank you.
Thank you very much. Anything else that you want to add at this time, Deborah?
We also just wanted to thank you for the update with the Department of Health, and thank you for the clarification.
Thank you. Heidi, do you have any questions of Deborah? Do you have her contact number?
I can send it to you, yes.
Thank you, I'd appreciate that. Thank you.
Thank you, Heidi. Members, you have a question? Sharon, Senator Moriwaki.
I just have a question from a different perspective on the implementation part of this. Heidi, thank you for your extensive work that you've been doing on coordinating and getting the models together. On the other side of it, the special ed teachers and how they're being helped, because I know they have to do the IEP plans. They also have to work with the different models, whether the students come in to the classroom, and they also have students that are working remotely. How are they being supported so that in the individual schools they're getting the support they need to do that?
Right. We have an extensive list, and you can see that on the website too, of the training modules that are available to them. They're offered in a synchronous mode, and also then we tape them and provide notes for them if they are unable to meet live training. We also have our district educational specialists at every complex area who are charged with supporting the needs. It is very difficult for a special education teacher right now. Mm-hmm. And we continually offer training. We offer one-to-one sessions with our teachers. We offer complex area or school-specific trainings based on their needs. And we've gone out, a school will say, my special education teachers are having a very difficult time with X, and we send a team out to that school to do, to support those teachers with that. So communication from the schools or the complex areas to our office is crucial, and we continue to remind them to let us know their needs, and we are here to help and support them.
I guess it's in the classroom itself, if you have to do both remote and then also you have students in the classroom, how are they getting any support at all, or one teacher does all of that with a EA, or how does that work?
And depending on the school models, and this is one of the tasks that schools are going through, and we're finding where the difficult areas are and where it's smooth sailing. And one of the concerns is if I am a special education teacher and I do have some of my students who require in-person services, but I also have some can do it online. Schools are working, and it's difficult. How do we manage our schedule and how do we manage our personnel so that the needs of both can be met? And it's a challenge that we've not had to face before, but it's a struggle, and it's managing personnel and figuring out how we strategically now place our personnel, which may look very different because of these unique situations. The one that you described is a great example.
So you are looking at how you might support teachers in the classroom, especially with the need to social distance as well as bringing students in and doing the remote. It seems like a lot to have to juggle for one person.
It is, and it's not easy. It is not easy by any means. Yeah. But you bring up a very real concern that we are working and dealing with every day. Yes.
Thank you.
Heidi, my question is, so if a SPED student is opting for 100% distance learning, are they forfeiting their right to SPED services?
No. And if a student is opting for, IEP meetings are held, and it's determined what services can be delivered through distance learning and what services cannot. So the school is no free and appropriate education rights have been waived during this pandemic. So we are responsible for providing all services on the child's IEP to all special education students. So for the students who require in-person services, we must provide in-person services for those students. There are some students in that category whose families are opting for distance learning for the various reasons that they have. When that happens, a meeting is held, and the IEP team, parent included, there's an alternative learning plan that is created, and there's a form that is to be completed that specifies what services can be delivered during distance learning and what services can't. For the services that can be delivered via distance learning, specially designed instruction is absolutely still needed and expected for that distance learning part. What would be outlined in the plan would be the face-to-face services that the student will not be receiving during that time because the student will not be coming onto campus.
Thank you. Then you mentioned it earlier that not all parents have access to digital devices, your SPED parents. So what steps are you guys taking to maximize the outreach to these families so that they are in contact with the schools? I mean, I don't expect that the SPED teacher, besides having to teach the student, is going to take additional time to explain to the parents all the other information that they need to get. So how is that delivered? Is that in packets in printed form?
It's both. It's packets and printed. We also know that there are some families that are very hard to reach. And we have our social workers either actively serving them or doing outreach to identify them. We also know that many of our homeless children have not been coming to school, and we have our homeless liaisons doing extensive outreach, one, not only to bring information from the school to the families, but also to attempt to bring the child of the family back into the school.
Thank you. And at one time, it's been several weeks, maybe months, there was discussion about mobile vans, geared with digital learning devices and interconnect to go out to some of these remote families, whether they're homeless, SPED students, et cetera. Has that been implemented to help you with your concerns for our SPED students?
I think we had a mobile outreach for our homeless students when school was closed and during the summer months. The department also has mobile outreach. I don't have for whether it's a SPED student or a general education student, but for those students who don't have that connectivity. And I don't have the numbers to give you now, but we can get them and share the extent of that outreach as an IOU.
Thank you. I would appreciate that information. That's always been at the top of my mind for our SPED students who were not able to come into the classroom, but also did not have digital devices to be able to access their learning activities. So if you could get me that information, I would appreciate that. Members, Senator Kim.
Thank you, Heidi. I certainly appreciate all of the meetings that you folks have been having and questions being answered. My question is, as a result of these questions, has there been any implementation or changes within the protocols to address some of these concerns? What have been the results? Having meetings are great, but if you're not, what are the results of the meetings, and can you share with us or provide us information as to what have you folks then done in regards to some of these concerns raised at these meetings?
Well, I think the parent-friendly infographics are a great example. When we present at these meetings, for instance, at the SEAC meetings, and even members of SEAC and the members and the guests at the meetings, we're continually asking for clarification on our DOE terminology and how can we make this information is great for those who understand it, how can we put it in more parent-friendly language? And so the partnership among the various agencies came together and created these parent-friendly infographics. So that's an outcome of a discussion at some of these meetings. And then subsequent discussion was, okay, now that we've got these, and this is the phase for that example that we're in now, how do we ensure that we get these to all of our families? So now we have a resource, how do we ensure every family gets them? And thus the posting on the website, that doesn't address those families who are not accessing the websites, whether it's ours or a partner agency's website. Thus the memo going out to distribute these at the upcoming IEP meetings that will be held. And then if the meetings have already been held, to ensure that the families who participated in the previous meetings get those as well. So everything kind of snowballs and piggybacks off of each other, but I think that's one example of an outcome from a meeting discussion.
That's good to know. So I guess in the future, as you list these meetings, if you can put outcomes on it, as things happen, that would be helpful to the public, especially those who are not part of those meetings. My second question would be regarding teleworking. and especially what's happened at Dole Intermediate School. I understand that there are protocols that if they were to have found a positive case, that they would shut down the school, but I'm hearing from faculty and teachers there at the school that they did not close down, they were not informed serendipitously, and the union was not informed. So can you comment on those? You need to unmute.
Yeah. I'll take that down and get details to share to you in the near future.
When you say near future, because according to your protocols, it said they would shut down immediately for 21 days, yet according to the staff, their business as usual, and according to residents that live near the school, said they noticed there's, people walking around without masks, and so they're concerned. And these are information that is being sent to me via email.
Right. Our protocol isn't to shut down when there is a positive case, but I can get to you our specific protocols, and we have our health and safety handbook that gives specific protocols to follow when there is a confirmed COVID case, as well as when there is a suspected COVID case.
Okay.
So I can get you those documents.
Is a superintendent on?
I am on, and Senator Kim, I think we're going right into the next topic, so I'm wondering if this is a natural transition or whether you want me to.
Okay, so I wasn't sure we were going to address that, so thank you.
Thank you, Heidi. Thank you, Deborah. And Heidi, if you can get together with Deborah so that she can give those questions to you. Thank you, Superintendent, for joining us. Go ahead, Senator.
So Superintendent, according to my information, the Pandemic Contagious Virus Plan includes a 4-page cleaning and disinfecting of facilities protocol checklist that details procedures for the cleaning and disinfecting of facilities when a positive case is associated with a school. And according to the checklist, once a positive case has been identified, the campus is closed to all employees and students for 21 days. Is that not correct?
So the Department of Education actually issued a COVID-19 return to learn school reopening plan with a health and safety handbook. It's the health and safety handbook that's posted on our website that is the protocol related to COVID. The pandemic handbook, which is what is required for agencies to have filed with Hawai'i, that is being updated because of all the changes with COVID. Our guidance document is the one that was specifically created for COVID-19. The pandemic handbook is for any general statements about pandemic, or I should say about pandemics in general. So the pandemic handbook is actually being completely overhauled because of everything we've learned about COVID-19 since that was changes were made. So it's actually the health and safety guidance handbook for school reopening that I shared with the legislature throughout the summer, and the changes that were made there for the school reopening plan. We do not shut down a school automatically because there's a positive case. There are levels of risk assessments that are done, and there's a clear protocol in the handbook from page 12 through 15 about the protocol that schools must follow in order to then make a determination of the areas of the school that may need to be shut down depending on whether the staff or employee or guest was on campus and for what amount of time after there was a positivity and who that person interacted with. And so we can go over what that looks like.
I just want to know whether or not you folks have made an assessment that, in fact, Dole Intermediate had been following those protocols and on pages 12 to 15. And
Yes.
then the fact
Okay.
that the community around, that live around Dole have said that they have noticed that, you know, they have personnel not wearing their mask and so forth, which is concerning.
So let me answer those two separately, because I think those are two separate matters. One is this recent situation at Dole, where we've had several cases this week, resulted in a request from the Department of Ed to the Department of Health for a consultation process, which we actually went through this morning, to look at what is happening at that school, what's happening in the Kalihi region or the area, who are the feeders, what's happening in community there. That conversation is now being turned into an action plan specifically for that school. Yes, we did follow the protocols from the Health and Safety Handbook, but as cases either become more concentrated in an area, as cases or the health components of cases start to shift, and we are dealing with different situations, we have asked the Department of Health to have specific consultations for if there's a major change that has occurred. And that's what we asked for this morning with Dole School. So we'll be rolling out a plan with that school that's specific to that school and their data and the Department of Health's risk assessment that they give us around the conditions in that school. We would then share that out with community. But the protocols were all followed. The principal did a great job there. She was surrounded by her complex area team and the state office team. We have a COVID-19 response team that responds immediately to a text that's issued by the complex area superintendent and the principal working together when they are alerted of a suspected or actual case. We do not wait for documentation of a verified case before we take action. So within a very quick hour or within that first hour, the COVID-19 team, which includes personnel expertise, my deputy superintendent for the DOE, who's the lead of that, facilities, all of these experts come together, surround themselves around the complex area superintendent and principal, and they look at what data has been collected. Notification goes to DOH immediately so they can issue their contact tracing. While we're waiting for DOH to notify us of how they're going to do the contact tracing and what the results are of that, we collect our own information. We issue our own precautionary letter to community. There is often a delay between when we're told about a suspected case and the documentation. And so the employee, for example, may say, I was told I'm positive, and they may give us documentation 5 days later. It doesn't matter whether we have the documentation or not. We do some initial data collection of who that person was in contact with, what their attendance was at the school, which areas of the schools they went into. We shut down those areas. We notify anyone that they were with within 6 feet of space for at least 15 minutes of time. That's the guidance from DOH. And we give that information to Department of Health for their formal contact tracing. Meanwhile, within 24 hours, we've shut that space down, or those spaces that were impacted, sent folks home precautionarily to either get tested or to wait for contact tracing from DOH, and we clean that space, whether it's verified or not. We have cleaned spaces that then come back negative in terms of testing, but we rather take the precautions within that first 24 hours of time. So yes, we did follow the protocol. With Dole, we are looking specifically at that situation there in partnership with DOH and putting a plan together there.
Dr. Kishimoto, can I just...
I was going to answer the masking.
Yes,
issue.
let me follow up on this first.
Okay, sure.
On the contact tracing, so DOH, are you aware that DOH did in fact do contact tracing on these particular cases that was found at Dole? And how soon did they actually do these cases?
So we have met with DOH. We are now partnered up with Dr. Kembo, who's our new lead, who's working with DOE as of this week. I met with Dr. Kembo and with Deputy Tomiyasu, who's the other lead for us at DOE, and they are working with us to redesign some of the protocols, because we do not have what we hope we could have, which is within 24 hours, we need a response from DOH. Otherwise, we need to keep spaces shut down. We're waiting to, people have to telework or stay home until they get answers. And that can impact delivery of services and instruction to kids. So we're working very closely with them. The response on the cases at DOE have been, from several days in length. That's why I said that we need to, as DOE, take the action steps until DOH responds. I can't wait for that response.
Okay, so DOH has not been responding, even though they said that we have all these contact tracers, 200 contact tracers, that in this case, because I'm hearing and getting emails from people telling me they're still positive, have not been contacted by DOH, and in this case, you folks have not gotten 24 hours or 48 hours follow-up from DOH.
Senator Kim, that's correct. We don't have a consistent follow-up or guarantee of follow-up, but I have been told as of this week's meeting that I had, as I mentioned, with our new leads that have been assigned to us, Dr. Kembo and Deputy Tomiyasu, that there is a contact tracing team that they're standing up specifically for the DOE that I had requested, so that we have a go-to team that can respond in this timeline.
Well,
so up to now, no. That's what I hope that we can have in place immediately. It's necessary.
Yes, I agree with you. And during our visit at the convention center last week, we were introduced to that team specifically for education. So it's very troubling and concerning to me to know that these cases at DOE is not being acted upon quickly, or in the timely manner in which, they said they were going to be doing this. And so I'm very concerned about that. And was HSTA also informed? Because I'm hearing that they weren't informed about who was exposed, who was homesick, who is quarantined. And is there a process for that?
So related to the latest case, HSTA was not informed. It was not involving a teacher. HSTA, I believe, receives the notifications we send out to employee groups, I'm sorry, to not employee groups, at the school site. We've been told that they have been receiving those letters.
Okay, because I received an email from them just today saying that they were not even notified of the number of staff who was exposed to COVID-19, sick and home quarantine, and that we are upset. So I'm not sure how you can correct that, but I would
We'll continue to work with them, Senator. Our intention is to make sure we have really tight and good relationships and good data sharing. So we will certainly commit to continue to work on that.
I hope so. And in light of this going on at DOE, is there any move to allow the teachers to telework?
So we, again, had a meeting today for a plan of action, and we're, again, supporting the principal in setting up the system that's needed there as the immediate response to the recent cases. But also, it's not just about DOE. We have questions about, the schools are reflecting what's happening in community. And we have, Kalihi, we have Waipahu, and we have Nanakuli area who are showing larger spikes in positives in community. So we would expect that then that's going to mean we're going to have the potential of higher impact on school staff or students or others who are service providers in our schools. So our conversation with DOH is, what do we do? And that's why I talked about the consultation process. When these things happen in community, what is the consultation process where we can sit down with them right away and have a process for saying, is this something that we should be concerned about in specific areas related to schools, and what is the recommended action? So it's not just about telework, right? It's also about, do we have, should we be for a certain amount of time canceling the ability for special ed students to come on campus. We know that they have to receive those services, and so what do we do in that case? So it's really going through those layers of conversations and having a comprehensive plan when this is happening in specific regions like we're seeing right now. We have lots of places that don't have this, but we do know where those kind of I don't know if I should call them hot spots, but they're spikes in very specific communities.
Right. Dr. Kishimoto, thank you. You're so correct that the community, it's a reflection, the school is a reflection of the community, which again raises my concern because we've been hearing from DOH for weeks now, if not months, that they are in partnership with the community groups. And even the governor at the H3 mentioned, working with community groups. But even as of today, this morning, in talking with Kukuakali Valley, who DOH continues to say that they're in partnership, has not received any official partnership, have not, was told today that DOH is going to enter or find a expert in putting together an MOU only today when we've been talking about this, and they've been telling us they've been in partnership with these community partners. And I raise this because they have the health nurses, they have the people that can speak the language to many of the kids, families that go to those schools, go to our Kalihi schools that are from Pacific Island nations and so forth, and they have the resources to be able to reach out to these people, and yet DOH has not acted timely again, and they've told us they have, which have not been truthful, which again bothers me completely, that we are still in this situation and that they've not acted. I'm not, angry with you, Dr. Kishimoto, but you raise a good point that the schools have to work in conjunction, and we need the partnership in the community to work together on this, and that somebody has to be the one to pull it all together, and I believe that's Department of Health. So,
Senator, if I may just add a little more, I really was pleased with the conversation I had with Deputy Tomiyasu as the new lead that I work with directly now, and Dr. Kembo. One is, I did ask them about the school reopening and closure triggers that we are waiting for in order to make a decision about Q2 instruction. What are the data points that the Department of Education should use to make decisions whether we can have more kids on campus or need to have less kids on campus, right? Just like other states have those school reopening and closure triggers. They did meet with us for the third time. It wasn't just us, it was DOE, charter schools, and private schools. They had a group of 28 of us providing response to them on the model that they've created. They've looked at several state models. We had an opportunity to give feedback. Our timeline that we understand that they are adhering to, and we really appreciate it, is that sometime around Monday it'll be done. Sometime later in the week, hopefully it'll be released. Those triggers are what we're using in order to make decisions next week about Q2 reopening. What does it look like? We have no intention of having a widespread all at once reopening. That we know that that's not the way to do it, but we also need to be able to say that our decisions are based on very clear metrics that are created by DOH. So I really appreciate Dr. Kembo's commitment to finish up that work that they have started. The other piece is the
let me just say,
language.
Let me just also say that, I agree with you, and I certainly appreciate them getting to this. But again, they knew school was opening. We've been raising this. We've had meetings with you folks, for over a month now. And to say that they're only going to finalize this by Monday is troubling, again, because the urgency in which we have a death, another death, and how many more deaths because we've not acted urgently. So thank you for raising that. So please continue.
So the third piece I was going to raise was just in response to your comment about the language groups that we have. Kind of the visualization of processes that don't have a lot of language in it is really important. So it simplifies the understanding of process across language groups. But the other piece is the cultural context of how families communicate within cultural groups. And And so those kind of modifications would be extremely helpful to us. Our schools, certainly within communities, know that there's more multi-generational families in some communities. In other communities, there is a go-to person that communicates to the family, and so we need to know who those spokespeople are for community. We've got to keep adjusting for the cultural context, and we know that that's true when we're doing education in general, but even more so in this context. What we see, for example, is various understanding of what surge testing is versus going to your doctor for testing versus calling a telehealth line. That we know that information as folks who have interacted with these various approaches, healthcare approaches. But if you haven't, that added language is very confusing during a pandemic. And so the cultural context is something that, I've had conversations with DOH and all of the county mayors and just appreciate everyone, continuing collectively. We all need to keep looking at what's working, not working, and adjusting to make sure that none of our families are missing this vital information.
Thank you for that, Dr. Kishimoto. I know you have a hard stop at 2:30.
But she didn't respond to the mask. And then the last question I have is that handbook that you mentioned, is that on your website?
Oh, yes, it's on the website. Every time we make an adjustment, so if you go into the main page of our website, the very first button is called, COVID-19. You go in there, and the very first button within there is our safety handbook.
Because public
everything is in
questioning
there.
me.
Yeah, the visuals are in there,
Okay.
and all the actual handbook that every school has to follow that.
Thank you.
In terms of masks, I have, so every once in a while I'll get an email saying someone on my campus or someone in my community wasn't using a mask. We very quickly say, send that information to the school site. And sometimes it's hearsay or they weren't really on a campus. Sometimes they were on a campus. It is non-negotiable. Everyone has to have a mask. The exception is really under the age of 2, according to the Department of Health, and young people under the age of 2 are not on our campuses. So everyone has to have a mask. There are very few exceptions for health reasons, for respiratory reasons, but we have strict guidelines around that. So we do encourage folks, contact the school principal or vice principal, and they're taking action right away. We are also setting up an email site because we want to make sure that people aren't giving information like that if they have questionable information about us not following protocol. If they tweet it or they use social media, that's not an official site for us to get information. So we have set up an email hub to have information like that turned in. So we're going to be rolling that out very shortly. My communication team has set it up, and we'll be providing guidance around that central site because, again, as I tell all of my staff, we're all keepers of health and safety, and so we need to address anything that is that we're told about very quickly, and we have been.
Okay, well, it's important that the principal is a good example because one of the emails is saying that she was walking around campus with one of the CAS on Tuesday, September 9th, and they were not physical distancing, walking around the campus and so forth. So again, we got all these people sending us, so it's important that the leaders and the principal and so forth are following these protocols, or others are not going to follow it as well.
Absolutely agreed, Senator.
Thank you.
So, Dr. Kishimoto, I have grave concern for the teachers, employees of, and students of Dole Middle School if the Department of Health has not been activated on the campus yet, because I don't know how you put in place your metrics to reopen a school when you don't, the metrics to close it has not been defined. And I know that the understanding of the process is that the principal, when there's a suspicion of a COVID case, the principal calls the CAS calls an immediate WebEx meeting with the COVID response team, which is the Deputy Superintendent, your AS Facilities Guy, Tanaka, your AS OTM, Covell, AS Armstrong, Communications Person, Lindsay Chamber, Student Health, Jay Ryan, the CAS, and the principal. And after all of this, and the the superintendent yourself contacts DOH, which you say you did for Dole, but, so what's the
So
prognosis?
Senator, I don't contact the DOH. That's done immediately at the same time that the COVID-19 committee is done.
Okay, so
we don't
is the
waste
process
any
on the
time.
DOE website? Because
Yes.
I told you
yes,
this
there's
before,
in
and
fact,
apparently there's still some,
They said it's not complete, according
Yeah.
to what I'm getting from here.
So there's a flow chart on, I'm looking for the, from pages 12 to 15 includes the flow chart of what has to be followed.
They said protocols
But
are
I
not
think the
complete.
protocol for COVID-19 case should be front and center of the DOE on every school website as well as the DOE's website. Go ahead, Senator, what did you want to say?
No, I'm just saying that people are listening and going to the handbook and saying it doesn't appear to be complete. And whether or not you've actually read it, that's what they're emailing me.
So if people are getting that perception,
I haven't.
I'm just having a hard time understanding, and I know you, as well as all of us, want to make sure and assure the safety of our students, our teachers, our employees, and if there is still COVID cases on that campus and they are not being notified properly, we are in deep kimchi. I'd rather say something else, but, oh, sorry. Do you understand what I'm saying? And this is why when we talk
Yes.
about telework, this would be the opportune time to close down the campus and put people on telework, if that is the case. But until we can assure that, and I don't feel that people are assured, I'm certainly not assured, and I'm not even on the campus, so I can imagine how the teachers are feeling. So as a superintendent, I think you need to give some assurance. If you have not been in contact with DOH and they've not done the contact tracing, how are you assuring the safety of the people on that campus?
So the work of sending folks home for precautions, we take anyway. We've done that. So we have folks working from home out of precaution, not because we had a positive. And we also follow the DOH guidance. We did meet with DOH today, as I mentioned, to make sure that every case that is suspected or actual on Dole campus is followed through on with contact tracers. So I know they've assigned contact tracers and are doing that work. Beyond that, we felt strongly that's not sufficient at this time, especially with some rising case levels concentrated in the Kalihi area. And so we have met with them to say, how do we take a look at this, even beyond the protocol? How do we take a look at this in totality in terms of just what we're seeing in community? What is your guidance to us? And that's what we received today. And now the complex area superintendent is working with the school-based team to roll out a plan. And that may be, is that today, Phyllis? It's being rolled out today because we want it. Okay, and so, yes, so we know we need to respond quickly to that school community. We are equally concerned, and we don't want people sitting around in fear. And so the only way we can mitigate that fear that's natural is to be able to have quick responses, and we acknowledge the criticalness of that.
So who in the DOE is in contact with DOH as of today to see where they are? I mean, I would think that you would want several contacts a day to all the cases that are under contact tracing to make sure that there's not the chance that it has spread to others, and if that has, those others have been contacted. So how many times a day, how closely is the contact? Is it someone in your office? Is it one of the ASs? Is it the principal? Who is that person?
So it's certainly the principal who has to be involved, the complex area superintendent, and then our health administrator out of Heidi Armstrong's office. And then deputy superintendent is the ranking administrator on behalf of the entire department. So that team works together for school-based decisions.
So who in the DOH are they getting their information? Is there a person given to them at that point that they are a school with COVID?
Yes, so our liaison is Karen Ng, who's been great to work with out of the Department of Health. That being said, again, Dr. Kembo, who's coming on to this brand new, and I don't want to speak for her, but I really appreciate the conversations we had this week about kind of renorming, reframing. We have our DOE team that's a quick response, rapid response team. I think for us, we need someone from DOH that sits on our rapid response team in order to ensure that both processes are happening in tandem very quickly. And right now they're on different timelines, and that's the struggle we have. So there is a course correction that has to be done procedurally on that.
Yeah, I think that should happen also. And we have Department of Health on standby right now, so maybe that will be one of the questions that we ask of them. Members, further questions?
Just one. Now that we're having the massive contact tracing, who from the DOE, that the central command that is set up at the Blaisdell, can be working with you guys? Because we're hearing that this free contact tracing, free COVID testing that is being done around the island. It's hard to find places that would be in the middle of the community. So I just wanted to know if the DOE is charging the free COVID units that's going around and using the DOE property. Do you know if you guys are charging them to use the facility?
Yes, we are charging them, but only for cleaning, just the actual cost of cleaning. We don't have a budget for it. We were told we were going to be part of this plan, and that's the only thing. We're not charging for use of facilities or anything else. In fact, we have our own volunteer team, principal and others who are showing up to make sure that folks are supported, the team is supported, and that there's access to bathrooms and so forth. It's only the cost of the cleaning, because we need to make sure that the facility is ready right away for our classes that are open for special education. This is high sensitivity. We've got to make sure it's cleaned at a COVID-19 readiness level to reopen immediately. So that's the only thing that's the only thing we are asking to be covered in order to have these spaces used. This would be no different than using any other city space or county space or other spaces. They need to be cleaned. We need the same thing, and we need it, except that we need it immediately. We can't shut down those schools for several days.
Thank you. And Dr. K, I wanted to publicly thank you on last minute notice that you were able to get 6 of the high schools over this weekend to do surge testing. I thank you very much for that. Senator?
Well, we appreciate Haima and the city for their work with us. Thank you.
I have one question, just going back to protocols in your health and safety handbook. It's not, you say that you have protocols for when you have a suspected case, but what if it's lesser than that? I've heard from a school that they had a student that came in who was coughing and sneezing, had a fever, and the teacher was told, call the parents, and she called the health aide. Health aide said, hold the student, we're not ready to take the student on, or call the parent. And so the teacher was left with not having any support. I wonder if your handbook can cover something like that, where the health aide is trained to make the call, take the student out of the classroom, and have a space for that.
Yeah, so I think whenever that comes up, it's important to know the location so we can, again, act immediately if there is a situation that hasn't been handled well. We have training for our health aides, but we also have registered nurses who are part of our Hawaii Keiki nurses, who are a go-to resource as well. So we have a whole system. We also have a requirement of having, every school has to have an isolation area if a child is sick or suspected of, we just don't know sometimes, right? They're showing some signs of being ill. It may not be necessarily signs of COVID, but we have spaces on each campus that are dedicated. It is also required of each school to stand up an adjacent bathroom that is only used by that employee or student that needs to be isolated immediately as decisions are made. or as we wait for a parent, for example, to pick the child up, or if it's a child that gets bused in to get services for them to take them back. So we do have a whole system for that. If there is a breakdown, we do have the first who can evaluate something correctly, and we can do that immediately.
Okay, because I do have the school name, but I don't
We
want to announce it
dedicated
here.
another.
So that at least it's
I'm
consistently
sorry, I was not able to hear you.
applied. Yeah, so I think, I do have the school name, but I don't want to announce it here, but if there's a way that it can be consistently
Oh,
applied.
no, you can text me or send
Okay,
it to me,
I'll do
please.
that. Thank you.
Can I bring up one last thing?
Yes, please.
Dr. Kishimoto, one last thing before you go. My sister is a SPED support teacher in Texas, and she emailed me this walking shield pod that she's using, and I'd like to send that to you because I think especially for teachers at SPED, it's kind of a bubble, and they have their hands and they have a zipper that they can open up, and it really protects them, and the students can see their faces. And so this is something that I'm hoping that, some of the monies can be used if teachers, SPED teachers, especially SPED, not maybe rest of the teachers, that could get some kind of support if in fact they feel that this is something that can help keep them safe in the classroom. So I want to send that to you to look at.
Lee Armstrong and our facilities team under Randy Tanaka work jointly around continuously looking at some of those safety features. So if there's some new things on the market that we can look at, certainly send that to us. Thank
Okay,
you.
good. I'll get that to you. Thank you.
Thank you so much, Dr. K. Appreciate it.
Thank you, Senators. Appreciate it.
Thank you for your team. Aloha.
Aloha.
So this is the pond shields, and they have it for kids too. Little kids.
Oh, how cute.
And
I
it's like
have that for my Lakai.
it's like a backpack. I have that for my
Really?
yeah. My sister uses it.
It's on clear on one side.
This is a pod shield.
How cute.
Yeah, and they have it for kids. She had to buy it online, and she said like $79. The kids is like $69, but they have like 10% off for teachers, she said. But the school can pay for part of it, and then there's a zipper in front so that they can take temperature if they want to take temperature.
We have the Department of Health with us, Dr. Janet Berreman from Kauai District Health Officer, Mr. Edward Mersereau, Deputy Director of Behavioral Health Services for the state of Hawaii, as well as University of Hawaii at Manoa, Dr. Victoria Fawn, Associate Professor. Thank you for joining all of us. Eddie, do you want to start, or is it Dr. Berreman that will start?
Sure. Thank you, Senator. I'll just do a quick opening remarks and then turn it over to Dr. Berreman. So thank you again, Senators, for inviting us to share with you some of the efforts that we're doing with the data, posting more data on our dashboard. This is a work in progress. I want to kind of preface it with the fact that a lot of work is going into putting this together, especially on the part of Dr. Fan and Dr. Berreman and others in the department. And the primary goal is to get as much information out there as broadly as we can and as transparently as we can, so that folks can use the data to make good decisions in their own lives, and so they can be good policymakers for themselves and use that data to make decisions about what they want to do and work with their providers and stuff like that. Very excited about this effort. What it's done, I've already seen over the last week since we posted it, We've already seen a lot of good progress and coordination actually between the many kind of data groups out there that are both in the private and public sector. And so our hope for this, and I think we're moving in that direction, is that this dashboard will continue to be kind of a hub from which data can come and go, and that we can share data among all of the other folks that are putting together mapping and other data sets. The good thing about this is that this is going to continue to push us towards a more of a universal methodology about how we collect data, how we track the data, that kind of thing. And so the more hands that we have in this, the better. The main thing is for us to be coordinated and kind of linked and synced as we do this. And so I'd like to do a presentation to you about kind of the metrics. Dr. Berreman will do that. And then Dr. Fenton will talk to you a little bit about what we're putting on the dashboard. So with that, with your indulgence, Senators, I'll turn it over to Dr. Berreman.
Thank you.
Thank you, Eddie. So I'm Dr. Janet Berreman. I'm the Kauai District Health Officer, and I'm not at heart a data person. I'm a pediatrician and a public health physician, and I was brought into this effort a little over a month ago with the charge to help us being elected officials and local policymakers as well as statewide policymakers identify a core set of metrics that could be referred to as we make policy and as we evaluate policy. And so I'm going to, with your indulgence, share my screen and talk to you a little bit about that, which provides context for what Dr. Fan will then show you in detail. Let me see here. Well, I apologize. I'm having a little bit of trouble sharing finding what I want on the screen right now. Here it is. So much of this you have previewed before. As we looked at choosing metrics, I thought that it was really important that we all be looking at metrics that tell us about all of the things that go into controlling a pandemic. So that means everything from preventing disease spread to detecting the presence of disease in our community, to containing it and keeping it from spreading further, and then to treating it or managing it in the healthcare system. And I think those words are pretty much self-explanatory, but I've listed on this slide the examples of prevention as things like masks and quarantine, and the local rules that have been adopted by our counties as well as by the state. Detection is about testing for disease, reporting disease, and looking at disease trends. Containment of disease is about case investigation and contact tracing, as well as isolation and quarantine. And of course, treatment is all of the ways that people who are unfortunate enough to become sick may contact the healthcare system. So those are the 4 buckets in which we were looking for metrics. And you know even better than I how important it is to have metrics to support effective leadership and data-driven decision-making. So that's the reason for going into all of this. The dashboard, as Eddie said, has been up for a week, and it still says prototype. It's not live yet. It's very much a work in progress. But we have made a few commitments, which I think it's worth being clear about with you. One is that it will be updated regularly, many of the metrics daily, some of them weekly, that we do plan to report all of these data, or as many of them as possible, at both the county and state level, although currently most of them are just at the state level. Again, as Eddie said, this is a collaborative effort. This dashboard draws data from the many excellent sources statewide and nationwide that are being used to collect data about the pandemic. And then finally, that we're committed to continuous quality improvement, refining and improving this as we go forward so that it meets everyone's needs the best that it can. So the 12 core metrics that we came up with initially, we being the mayors, the emergency managers, the governor, and the health department folks, in these 4 buckets were, I'm just going to go over them with you. The data that has wound up on the dashboard is much more extensive than this and it's become an even more robust tool than we initially imagined it to be. But on the prevention side, we wanted to look at the distribution of disease nationwide and the epi curve, or the progress of the counts of disease over time in the mainland as well as in Hawaii, because we know that although we're not physically connected to the mainland, we are connected very closely by frequent travel, and will be more so as travel restrictions are lifted. So what's happening on the mainland is relevant to what's happening here. And then we wanted to look at things that are more a reflection of personal behavior, and how much some of the policies and rules that have been implemented locally are actually being adopted and changing behavior. So we're looking at mask wearing behaviors, and also at mobility patterns, how far people go from their homes, and whether they're really mixing less in the community than they were before the pandemic. Then in the detection bucket, we look at the epidemic curve, the number of cases over time here in Hawaii at the state and county levels. We also look at how much testing we're doing and what percent of those tests are positive, again, to give us a sense of how widespread and widely distributed the disease is in our state. And then we look at sources of exposure, and that's things like clusters or locations of disease, of occurrences of disease. Then in the containment bucket, we look at our isolation and quarantine facilities, and in particular, what percent of those are currently occupied, which gives us a sense of our capacity. And this is for individuals who are not able to effectively isolate or quarantine at home. And that's a decision that's made jointly with the health department, caseworkers and contact tracers, and the family or individuals who are involved. The second thing under containment is the laboratory turnaround time, and that's important for disease containment, because if it takes a week or so for us to get a lab result back, then even if we can isolate and quarantine, and even if we can do contact tracing, so much time has elapsed already during which the disease could spread that those measures are not as effective. So we'd like to see a lab turnaround time of a day or two rather than more on the order of a week. And then the information that people have been very interested in, which is the timeliness and our ability to complete case and contact interviews. And you will see, we'll talk about that as we go forward. I do want to say that that's an area where we are still working with the Disease Outbreak Control Division to get good, clear data that are an adequate reflection of that. In talking with Dr. Kemble, who I know Superintendent Kishimoto just referred to, we have several indicators that are in the works for this, and we're confident that we will be able to have them to include in the dashboard within the next 2 weeks, and we hope sooner than that. And then in the fourth bucket of healthcare or treatment are the things that we tend to think about when we think about, oh, if there's a pandemic, how will we know that it's too much for us to handle? Things like what percent of our hospital beds are occupied, what percent of our ICU beds are occupied by people with COVID, and how much are COVID patients using our ventilators. I do want to make the point that those healthcare measures, the beds and the ICUs and the ventilators, while they're very tangible and a very high level concern for most of us, those things are all the result of people getting sick with COVID-19. So we can't control the pandemic by building more beds or having more doctors or more ventilators, but we can control the pandemic by keeping this flow from left to right, by interrupting or diminishing the flow to the healthcare end. So the more effective we are at prevention and detection and containment, the less our healthcare system is threatened by being overwhelmed, which I just think conceptually is what I would like you to think about as you look at the data dashboard in more detail as Victoria goes through it with us. And this slide sort of repeats what I just said, but it's really, I think, critical that you take home with you the message that no one item, no one bucket there, no one indicator is going to control this pandemic. We can't do it only with masks or with testing or contact tracing or quarantine and isolation or healthcare. We really have to be working across that whole spectrum all the time. And if we're doing that effectively, we'll titrate up and down on some of those things, but we'll always be working on all of them, and that's our best bet to control this pandemic going forward. And that's what we're hoping the data will inform all of our thinking about that. And thank you very much. That's the end of my remarks.
Thank you, Doctor.
Sure.
You guys want to stop and ask questions at this point? Senator Kim has a question.
Thank you very much for that presentation. I recently just got a email from someone saying that they received notice from DOH saying that they had a non-test, meaning that your recent COVID test results is incomplete. The result can occur if there's a problem, and I guess this person's concern is whether or not these non-tests are included in the DOH's data that talks about the positivity rate based on so many cases. Because if in fact it is, if these cases, non-tests were pulled out, would that change the percentage of the positivity?
So those indeterminate tests or non-completed tests are not counted as positive cases, but I don't know the answer to whether they go into the denominator of whether they count as tests. I'm afraid I don't know the answer to that.
Okay.
Dr. Fan might know, or I can find out from Dr.
Can we find out? Because that would make a big difference as to how that percentage that they keep saying, oh, Hawaii's at this percentage, that percentage. But again, what's the denominator? So
the indeterminate tests are a relatively small number of the total, and I know that only because we get notified at the district health office level anytime a test on one of our residents comes back that way. So I think that the impact would be small either way, but I can certainly find out.
okay, thank you.
Sure.
Any more questions? Dr. Fan?
I was just about to comment on that last piece, that the sources of test data are fairly comprehensive, but I believe there are certain private testing efforts that may not be included in the testing numbers. I think that's also an important point to reflect, and they also reflect only the PCR tests, so they do not, or if they now include antigen tests, it's a very recent update in the last day or two. But yeah, maybe they haven't yet been updated with the antigen tests. Janet?
I believe that the antigen test positive individuals are indicated in the table of probable cases that's on the older DOH dashboard. It's not on this new dashboard, but my understanding is that the antigen testing is not included in the percent positivity calculation. And that will be a more significant issue going forward.
So Doctors Berreman or Fan, so what is the source of the data that you're getting for these tests? When you say it's not the private tests, if any of these tests are being done, wouldn't it come to DOH or no?
So the source of the data, most of it's a combination of commercial labs and the state labs, and it's all of the results that are reported to the Department of Health. But the antigen testing that Dr. Fan was referring to is not consistently reported at this point, and that's an issue that we're working on. But the majority of the testing is PCR testing, is reported to the Department of Health, and that's the source of these data.
So it's only PCR testing, so it's not, for example, the surge testing that's gone on from the Surgeon General. All of those tests are not being reported, even if...
No, those tests are PCR tests, and they are reported.
Oh. They are? Even those swab things that aren't oh, okay, that's good to know. Thank you.
You're welcome.
Good. You have questions? I think we're good. Can we proceed with Dr. Fan?
Thank you.
Hello, Senators. Thank you for having us today. Not sure if you can see the screen here. So as my name is Victoria Fan. I'm a faculty at the University of Hawaii School of Social Work. A little bit about my background is it's in engineering, epidemiology, and economics. And 6 years ago when I moved back home to Hawaii, it's become sort of my personal objective to try to build the pipeline of data scientists and people really excited and gung-ho about health analytics. But not just people who can crunch numbers or know data, but more importantly, people who are kind-hearted, hardworking, humble, and very importantly, have very strong team skills and communication skills. So our role here at the University of Hawaii has been to support projects funded by the Department of Health, Behavioral Health Administration, and we were asked by Deputy Director Mersereau to assist with this request. and we've built a number of dashboards for BHA in the past. The first thing I just want to say is a huge mahalo to all of the people that have been submitting data. You know, the word Laulima, many hands. There's like a dozen or so data submitters to this dashboard. Particularly want to thank Haima and the State Office of Planning. They've been extremely collaborative and very instrumental and one of the most responsive data partners that we've had. Also want to give a huge acknowledgement to the Disease Outbreak Control Division. Their dashboard continues to be essential, continues to be one of the most essential sources in terms of testing and contact tracing. And I just want to emphasize that this role that Eddie Mersereau and Dr. Berreman have been playing, particularly with the data coordination, cannot be underestimated. That probably takes up the vast amount of time. Putting the numbers into this dashboard is relatively easy, I think, compared to the efforts to get everyone synced up and linked up and synced up, as Deputy Mersereau likes to say. And it's not just linking, but really syncing up is really quite important for this dashboard because, as you can see, updated 10 a.m. this morning, you gotta get everyone to sync up their submissions all at the same time. It's like paddling, and you gotta, if someone's out of sync, it's just gonna throw the whole thing off. So I want to just thank everyone for all of their cooperation and syncing up this dashboard. It is a centralized, our aim is to be centralized but not duplicative. We draw from multiple sources and many stakeholders all working towards this common goal. And the idea is that it gives a high-level snapshot. Just like when you're driving, you have a dashboard, you can see whether you're driving too fast or too slow, or you're driving efficiently. And so with a dozen data sources and maybe 50 data points or so that we collect and compile into this dashboard, it seems, you know, it, on the one hand seems very simple and basic, but I assure you it takes quite a bit of effort from many people behind the scenes, and I want to acknowledge all those people who've been helping. So as you've seen, there are these, I don't know if you can see my mouse, but there are these yellow stickers which indicate that these are new indicators as part of the release of the dashboard, which has been out for now a week. And we also have, I think actually all of the labels have now been removed, but there used to be blue labels that said coming soon, but we've now managed to get some of the new indicators after the initial release. So we're very excited about that. Just briefly walking you through it, on the left-hand side, we've got prevention and detection, mask wearing, based on the week of September 5th. This is hot off the press new data that was collected by UH School of Nursing, and Dr. Berreman has been instrumental in getting these numbers. We have the breakdown by island below, and I think in the future we will just break it down by every county rather than conglomerating all the neighbor islands here in one. The mobility data that's compiled and presented by Hawaii Data Collaborative, also a very essential data partner of ours. The statewide testing information. We're really excited that DOC-D, the Disease Outbreak Control Division, has now managed to push out the one-day test turnaround time, which is a critical indicator of how timely is the response, because how quickly people get their lab test results is crucial in this game of timeliness. And we've also got some information about the tests conducted, the positivity rates, the lab capacities. And if you scroll down, you'll see here about the inbound travelers. This is from Hawaii Tourism Authority. We've also got the epi curve, the epidemic curve, as it said, from DOC-D. We've got some new cases, the active cases, cumulative cases. I will just make a note that any one of these indicators is quite, you know, a number, as I said, is a number, but behind it, there's a lot that goes into calculating it, and depending on who you talk to, people have different ways of calculating the same thing. And so even the percent positivities, they're depending on which resource you go to, whether it's CMS, Johns Hopkins, DOC-D, or you know, other counties and states. There are 4 different methodologies for counting percent positivity, so we should just be straight up and clear which definition we're using. And these, the definitions of these are built into the website. So if you go to hawaiikovid.com and you click on the link here, you'll see beneath this dashboard the actual notes which describe some of the information about how these measures are calculated. Okay, moving on, we've got information about the contact tracers each week. Now it's being submitted, and we're really excited to see slight increases here in the number of contact tracers. We're still working on updating the PPE numbers, but we can see that I think there's PPE is a huge component of our public health response. The hospitals have also been submitting some of the data, and we're still working with them to make sure we have all the right figures and numbers. And again, same point about depending on how people have their own preferences about which denominator should be used, numerator should be used, and so on and so forth. So that's part of the data coordination effort that we need to communicate and make sure we have a common understanding of what is the best measure to use. Moving forward, we've got some of the isolation and quarantine numbers updated on a daily basis at 10 p.m. every single night. And we're looking, this is only currently for Honolulu, and we're looking forward to adding the neighbor islands very, very soon. And we also have fatalities here. And then finally, the high PEM forecast, which is updated and part of a work group that's affiliated with, but not directly under the Department of Health. Moving down in the dashboard, we've got the big picture piece. So from the CDC map, as well as the US EPI curve, which looks quite different from the Hawaii curve. We've got the detailed county level measures of mask wearing, some of the mobility data. And again, I just want to acknowledge that my team is working really hard to get this interactive. We're really close, and we'll have something to release very soon. And moving down, we've got the detection piece. Again, a source of data from the Department of Health Disease Outbreak Control Division. And then I think perhaps the most a new indicator is the cluster data, which is of high interest by many people, and hasn't been updated recently. And we're looking forward to working with DocD to figure out what the best way to calculate and estimate this moving forward. Again, we're still looking forward to developing the case and contact timeliness information. They've managed to pull together the lab test turnaround time, and we look forward to having this updated more frequently. And then finally, some of the hospital data. Again, we're hoping to make a comprehensive time series so that there's no gaps from the historicals. And so with that, I will just conclude to say that the release of this dashboard has raised Hawai'i's COVID tracking page dashboard grade from a D to a C. And as a faculty member, we should be all inclusive of all kinds of grades. So C is pretty good. It's pretty average, actually. So I'm looking forward to moving this to a higher grade. And again, can't do this without everyone's support. So mahalo.
Thank you, Dr. Fan. I have questions on the charts. Your 0.92% death rate, is that based on what?
I believe that is
on the positive cases.
Yep. I have to check the exact definition. I'm sorry, I don't have it off the top of my head. It is submitted by Haima and DocD together. Okay. I'm sorry, it's been a very long past couple of days. It's just eluding me right now.
And the other one I questioned, the mode of transmission. I'm having a hard time reading the numbers, but on the school, I think it's a 43. And that seems, except for travel and congregate living, that seems to be the highest. Is that correct?
No, actually, if you're looking at the Senator, if you're looking at the cluster data, you're talking about the cluster table. So if you're looking at the cluster table.
Yeah, no, I'm looking at the cases.
Okay.
Yeah, mode of transmission.
So there's congregate, and then beneath that there's funeral at 75, office, and actually school is next at 43, and then office at 42. And I should say that these were only the clusters that were submitted by DocD. I do know that they're there are more clusters that need to be compiled and tabulated as part of this effort.
And this is up on the web now, or?
Yep.
Okay, thank you.
Could you say where it is on the website, so people can go to it?
Yeah, thank you, Senator. It's hawaiicovid19.com. Hawaii is all spelled out.
And does,
So, in
yeah.
to Senator Gianni's question about the mode of transmission, excuse me, sorry, Senator Milwaukee. What it looks like on this chart is the school entry. What I read on here is that there was one school cluster that netted 43 cases. That I'm interpreting that wrong, right?
Go ahead, Janet. You're on mute.
Sorry. So the table indicates the number of clusters and the number of cases associated with that. I'm not familiar with that particular cluster, but what the table shows is one school-related cluster and 43 cases.
Just to clarify, that this particular number was compiled from two different sources. So we're still, the initial number of cases associated with that cluster was 4, but then we were asked to insert the number of all school-related cases into this table, and so that's how that increased from 4 cases with that one cluster into 43 cases associated with schools.
What
So
school
I
is
think
that?
I need some sort of clarification, right? Because I don't want the public to panic and go, what school is that? That has 43 active cases. When it might be the DOE as a cluster has 43 cases spread across 39 schools across the state, right?
You're absolutely right. We need to change the cluster number or just take it out.
Thank you.
If I could call your attention to something else on
Dr.
that
Berreman
slide,
is freezing a little bit, but I think that what she's saying is that that's an excellent point, Senator.
I'm sorry, I didn't hear that, Eddie.
I said Dr. Berreman is freezing a little bit, but I think what she's saying is that that's an excellent point.
Okay, yeah.
We'll address that moving forward, because it is part of the balance that we want to have is, and as the public has asked, and as your body has asked, is where are these clusters happening, which is important information. And then the other kind of part of that balanced perspective is, to what degree do we kind of elevate fear and stigma by being too granular about where we say these clusters happen, and balance that between letting people know where the clusters are so that people can make good decisions about, for example, where they should be going. And I think one of the biggest points in that table is that we still see general community spread as the largest amount of cases where we have not been able to identify or trace it back to a particular cluster or site in terms of where that case originated from. So, and as we've talked before, and as Dr. Berreman has talked about, when average of about 50% response rate to the folks that we're trying to contact trace, makes it a little bit difficult to completely narrow down on those clusters.
Well, it's difficult because we're not having timely contact tracing, as we heard from Dole School, that DOH has not been able to get to these positive people to contact trace in a timely manner. So that's one concern. The other question that I wanted to bring up is, on the contact tracing, when you say reserve and trained, what does that necessarily mean?
Go ahead, Jen.
Shall I try again? Apologies for the technical issues. So For example, on Kauai, which is what I know best, we have trained 61 individuals who are available to act as contact tracers. And they are called into service to do that work on an as-needed basis. So most of those work for the Department of Health, but some of them are Medical Reserve Corps volunteers or emergency hires for this purpose. And they may be doing contact tracing only a couple of days a week, or they may be doing it full-time, or they may not be doing it at all. So, so these are people who are, the people in reserve are people who are available. The people who are listed as active are doing at least 24 hours a week of contact tracing and case investigation activities.
Okay, so in Honolulu, we have 134 active, 446 reserve/trained. Now, I know that University of Hawaii trained supposedly 400 people. So is that what that, because I'm still getting emails from people saying they're not been called, they've not been activated, and just recently got an email saying that they're hiring, the city is hiring military instead of going ahead and hiring these people that went through the training and were told they were going to be hired. So do anybody on today's meeting here know any of this or have any information that can share?
I can't give you the comprehensive response to that, but I can tell you that those people trained through the University of Hawaii include people on the neighbor islands, and that a fair number of about, I would say, I don't know the number off the top of my head, somewhere between 8 and 10 of the individuals who are among our 60 contact tracers are people who were trained through the UH system. Some of those were already DOH employees that we wanted to bring up to a higher level, and some of them are community volunteers. But I can't answer the bigger picture question.
Okay, because it's misleading to say they're trained, because we know there's people out there trained, people out there willing to volunteer, but if they're not being activated, that's another concern that I have. And, you know, if we're paying military people when we actually told these students and did an MOU with UH that we were going to hire these people, and they're not, and they're being listed as trained. And I know I'm not blaming you guys, but, you know, that's a concern, and that should be asked before we put this kinds of numbers on the page and make people think that, you know, they're ready to go when they've not even been talked to. They said, don't call us, we'll call you.
But I
so
do.
Senator, we could. It's a really excellent point. We could. I can do two things. One, we can. Dr. Fan can put an explanation on the notes as to what that means, what the definition between trained and active are, and then I'll work with Deputy Director Tomiyasu and find out the rates to which Dr. Campbell and Dr. Robertson are bringing people on. I know that they're bringing on people day by day. I just don't know the rate to which they're onboarding those folks, because those numbers are ticking up from the last time that we talked to you about this. So I can get the rate, I can get the kind of average number of, or the total number of people that have been onboarded over the last couple of weeks.
We appreciate that, because, you know, the whole purpose of having this kind of dashboard is to give the public accurate information timely. And if we're not, then, you know, why have a dashboard if we're not going to be able to do that? So again, I appreciate the efforts being put into it. But again, it seems as though the information that we're giving out to the public may not be accurate.
And let me just add to that, Eddie. I think when I look at this and knowing that there are 446 people that were trained in Honolulu alone, and we're only using 134, and we're using, say, Iep to help with contact tracing when they could probably be used for other things. One of the things that I look at this and I see is that maybe we're not using our people in the way that we should, and this should be a discussion that we have with, you know, the governor and the mayor, because one of the things that we know is that the people in quarantine weren't staying in quarantine, but there was nobody to go out and you know, ticket them, arrest them, or whatever. And this was one of the things that we had talked about before, is to use Iep as guards, if you will.
Because we're using the AG investigators, when they
Yeah.
should be out investigating to do
Correct,
that.
but this is what I get out of this. So for me, I see a great importance in this chart, and I really appreciate that. I think also when you look at the cases and clusters, what we're looking at for the schools at the, one cluster at 43, well, that may be, the DOE, and 43, we know, I think there were 6 at Dole, but, I think what that tells us is that if we can break it down a little bit better so that this will also, if the DOE won't tell us, and specifically what schools they are, I think, when we do hear the news and it, hear it on the news that it's, say, Dole Intermediate that had this outbreak. If the contact tracers, the 134 contact tracers in Honolulu, are not able to get to all the positive cases and do the contact tracing, and we know that there are a lot of Pacific Islanders, in that area, and, they are a very at-risk group. And we're not getting the information in time to them to make sure they wear their mask, make sure they social distance, and be extra cautious because there's active cases around them. That's what's important in this, to me, in these graphs, and I thank you guys for that. But I think for us as legislators, this helps us point to where we should be, putting more effort in talking to our governor and our mayor to look at deploying more of the contact tracers so that we can get them more quickly notified and prevent the widespread. Thank you.
And let me add to that, we appreciate the National Guard, we appreciate our military stepping in to help us with contact tracing, but they weren't trained for that. And we kept hearing from DOH that we need specific people, professionals to be trained. It takes a certain individual, and therein lies the fact that they did an MOU with UH to get these people trained. And so to hear that they're not hiring them and they're going to hire the military when we can use them, for the military, for other areas in which they were trained for, again, is troubling. And we need to put those priorities together, and somebody's got to organize that. I'm not sure who it is. It should be Department of Health, yet it's not happening. So, Eddie, please take this information back, because the public is not happy with this.
Senator?
Will do, Senator.
Senator Moriwaki.
Hi, thanks, Eddie. Dr. Berreman, a question. When you get the data on the number of active cases, we have the number of contact tracers. I wonder if Doc D has information on the number of contacts traced. Because if we don't know how many have been traced, we can't know, do we have enough tracers or not? I don't know where that information can come from. I guess Doc D, but if we can find out how many people have in fact been traced, it would be helpful information as well to look at the volume and the amount of work, because we've been hearing that the people who were doing contact tracing, the investigators were doing contact tracing with the public health nurses. We didn't know, but some of them were having 100 cases, and that seems to be just really overwhelming. So if we can look at the number of cases being traced, some idea of volume.
That's an excellent point, Senator. I think that's something that we definitely can work towards incorporating. And then also to add to that, incorporating potentially the number of responses to trace attempts, because I know that we have many trace attempts that never get responded to.
Yeah, I've read that that's a problem as well, is that people don't want to respond, and I think the more we can make it important for people to respond, having that kind of information is helpful in developing your protocols as well.
Yeah.
Thank you.
Thank you, Senator. Thank you for that feedback.
Would you like me to elaborate a little bit on that experience, Eddie?
Sure. Yeah. Go ahead.
Over the last 2 weeks, because Kauai has not had so many cases, our team of contact tracers has been assisting with doing the initial case investigation interview for Oahu. And over not quite 2 weeks, we've worked through 1,300 new cases. And we have plenty of contact tracers to do that. We've had 20 to 25 working every day, and we've been able to get through our list of new cases every day. But what we've observed very consistently is that we're able to complete that initial interview on just a little over half of the cases. And the other half are people for whom we don't have a working phone number, or it's the wrong number, or we call multiple times and leave messages, but we're unable to make contact with them. So I just think it's an important thing for the public and your constituents to know that part of the battle is having enough contact tracers, but part of it is also having people willing to answer their phone to an unfamiliar number and to talk with us.
And one other piece to that, to add to what Dr. Berreman is talking about, is that and also to kind of go back to what Dr. Fan discussed, is that there are a number of entities in the community that are doing testing, which is terrific. I mean, the more testing that we can do, the better, and the more entities that are out there doing that, the better, from individual providers to groups that are doing kind of broad testing. What is important is that when they do that test, when they actually do that test, that they gather as much information as they possibly can, because then when that positive case is identified, that positive case is reported by the testing company or the testing entity to the Department of Health. And if the information that is received by the Department of Health is not accurate or not complete, then we end up in the situation that Dr. Berreman is talking about, where we're trying to contact trace somebody that doesn't have a working number.
I think it's important that you have the dashboard, but also important for the policymaker or for the implementers to know these kinds of things, of the 50% rate in terms of not being able to contact people, and the other is from taking the test to the time, getting enough information so that when you have to trace contacts of a positive case, that information is there and you don't have to go around scurrying looking for information, that it would be helpful to have that kind of analysis or results, not maybe on the dashboard, but somewhere going back to those who have to implement, or if we have to change laws or if we have to change rules or whatever.
So Eddie, can I follow up one more thing? Eddie, I'm reading this email from HSBA, the Hawaii State Bar Association, message from Lieutenant Governor Green. We're looking for volunteers to help the contact tracing team. Rather than doing actual contact tracing, volunteers will be making first calls to COVID positive cases and checking in on them. How is that interfacing with what's going on? Because I know that many volunteers have wanting to volunteer to do contact tracing and have not been called upon. And I know that unemployment is saying they wanted to use UH law students to help with doing some of the unemployment cases that had legal issues. But are we asking the Bar Association now? Because I have this email from the bar to the lawyers out there about volunteering to do this.
Well, I think, Senator, I definitely will follow up on that. That's the first I'm hearing of it.
I can send you a copy of this.
Please, thank you, and I'll follow up on it. I think from my perspective, there's a lot of ways that folks can help, and it's just a matter of helping them identify where they can help, because we'll take all the help we can get in fighting this pandemic. It's a global pandemic. So it's kind of all hands on deck. So I'll follow up on that email, Senator.
Yeah, I have something. The part when I'm looking at this, the cases and the clusters and stuff like that, my concern is that, we hear from the media, like with Dole and the prison, we hear from the media. So I just know in the Department of Health, I'm pretty sure they watch TV or somebody's watching TV, when they said there's a sheriff that would contaminate a prisoner at this location. What does the Department of Health do? Sit on their toes and sit there and wait till they get the call? I mean, why don't they be proactive and say, hey, let's go send somebody out to the prison and let's go interface this thing so that we can catch it on head on. Same with Dole. I know it's not your fault, but what I'm saying is that why we wait till we see 34 cases or 43 cases one cluster, like you said, could be spread out. Then you look at the bars and clubs and restaurant, 11 cases, and I can't even see that. 5, whatever the number, I can barely see it. The bottom line is, we shut down the bars real quick, but then we still have the schools open. You know what I'm saying? So I look at these numbers and I was like, wow, okay, wait a minute. These guys get way more. 11 in the bars and restaurant, and 43 in the school. But let's just shut down the bars and the restaurants. I mean, this is the kind of stuff that this collaborative data, where they're coming up with their idea of opening and shut down. You can go to the beach, but you gotta go by yourself. But your grandma and your grandfather told you, never go to the beach by yourself. I mean, where are they getting these kind of ideas? Or go hiking by yourself, but they tell you, always take a partner. I mean, this is the kind of stuff. How can, you know, it's a miss and hit situation. Yeah, it's no data that the community can trust. So by having this here, telling me I cannot go to the bars, but I get less cases than
You're safer
the
in
school.
the bars than you are at school, is what this
Yeah,
is. You know what, Eddie, we're not ragging on you guys'
we're
data.
not
We're just frustrated. Thank you for listening.
Just so happy you is here, so sorry. You know what I mean? But you know what I'm saying, right? If somebody from the Department of Health heard that the sheriff, which was on the news, that he had may contaminate one prisoner at the time. If somebody from the Department of Health went there, addressed this prisoner and his guard, sheriff, and find out the information, and then right there, you got the tool, so now you can find out how much contact tracing it is. But we wait till the thing develop, and there's an epidemic, and then heads roll after that, you know?
So what I hear you saying, Senator.
Heads never roll, sorry.
No, it's okay. Well, and first of all, I wish I had time to watch TV lately, because it's been pretty gnarly the last few months. But Senator, what I hear you talking about is the idea of being proactive versus reactive.
Yeah.
And that's something that we're pushing, and this dashboard is just one kind of item that shows that we're doing that. So we get the proactively get the data out. And I think what may answer to your question in relationship to OCCC, for example, our Dr. Campbell has a daily meeting with OCCC every day, 7 days a week actually, to discuss where things are at with particularly the OCCC clusters and infections. So we're aware.
Yeah, but when did this meeting start? When the person that's going to these meetings for the Department of Health, when did this start?
Those meetings have been going on for probably about 3 weeks now. So that's one area where I think I can safely say that we know about that incident before the media does. Not all situations can I say that, but I think that's one that I can say.
Okay. All right, so you can call the mayor and the governor and tell them they can open up the restaurants and bars, since we have the lower count in the schools. Thank you.
Does Dr. Berreman want to also respond?
I did want to comment mostly about that table, because I know there's a lot of interest in understanding where the clusters are so that people can understand where to go and where to avoid. And I think, as Eddie said, one of the aspirations of this data dashboard is to help our policymakers make data-informed decisions, so that as we go forward and see the kinds of restrictions that are in place or lifted, they will make more, they'll be more readily understood, and we hope make sense to the public seeing those, because of course we're not making those policies, but by providing the information. But there's another thing on that table that I want to call your attention to, which is the line that's labeled community, and the number in there of the number of cases is about 2,300. I can't read it either, but I know that from having seen it before. And I call your attention to that because 2,300 is a much larger number than the sum of all of the cases associated with the kinds of clusters below there. And what that tells us is that the vast majority of cases are not acquired in association with any known cluster or any other known confirmed case. It's kind of like when you get the flu or when you get a cold. You may think about, oh, I wonder if I got it there, but you don't really know where you got it. And because over the last several weeks, COVID-19 has been circulating quite widely in our community. Even with a completed case investigation, it's often not possible to determine where somebody got sick. And those are the cases that go in that community acquired line or category. So it's just important for the public to understand that it's not just about avoiding certain places or types of places. It's also about using these safe practices of masking and distancing and avoiding mixing, especially in closed spaces, all the time, because it is circulating in the community.
No, I think, go ahead.
Go ahead, Senator.
No, I totally understand that. But going forward with this data, and you're saying certain people should be looking at them and they're going to make correct decisions. To me, I mean, if I look at this data, you know, like how we've been saying all along, so if we're going to be shutting down and opening and doing certain things, and by looking at the data, we understand the community level is high, totally understand that, but how we've been saying it along, so certain establishments, if they break the rules or the rules are not followed, then they should be closed. But to close them across the board, making them suffer in this pandemic, losing revenue and money, and you know, they still got to pay their rent. They still got to pay whatever the necessities they got to pay. You know what I mean? So, you know, if guys who follow the rules, I give you an example, the Zippy's right over here. You walk in there, they get the temperature detector right there, boom. They get one lady with the sanitizer, sanitize your hand. You walk over there, now they get plexiglass all around the place. So these guys are following the rules. But then again, they got shut down for another 2 weeks. I mean, is that fair? Justified? I mean, according to your data box, I mean, that's not fair. You know, I mean, I know it's not you guys, Kuleana, but it's not fair. I mean, these guys who are making the decisions are probably not even looking at you guys' dashboard, and you guys work hard on them, and they should pay attention to them. I think they'll make better decisions if they look at you guys' dashboard and understand that certain places can be open. You can walk in Walmart, Long, Safeway, all of these places, but then you cannot go to Zippy's and sit down and have a sign-in. You know, I mean, this is kind of oxymoron to me, I guess. That's what you would say, right? I don't know. But like I said, thank you guys for doing all the good work in the data, and hopefully our leaders can really pay attention to this and make better decisions. Appreciate it. Thank you.
I have a question, Dr. Berreman, and it maybe was more appropriately brought up earlier before we got into the data presentation. But, you know, we had Dr. Hoggard Green from Queens before the committee last week, and she indicated that I guess the prevailing sentiment among clinicians now is that the testing recommendations have deviated from what we were told continually from the beginning of the outbreak up until now as it relates to testing asymptomatic individuals. And I'm wondering if you folks are able to comment on that, and has there been some sort of overall Department of Health guidance amendment to the recommendation that only symptomatic individuals take the PCR test?
Yes, the medical advisories that have been issued by Doc D over the months have evolved. And in the beginning, when we had very limited testing and it was all done at the state laboratories, it was extremely limited, and people could only be tested if they met very specific criteria. But it has gradually loosened over that, and the most recent set of recommendations that were released were very in line with the Centers for Disease Control that specify situations in which asymptomatic people should appropriately be tested. And there's ongoing work to continuously update the testing guidance for the state.
So I guess just for my own edification, because I didn't read the guidance, so excuse me. Can you walk us through, as of today, what is the medical guidance on testing?
I'm not going to be able to walk you through it off the top of my head, but I will say that we are recommending testing for all asymptomatic close contacts.
So that's 15 minutes of exposure within 6 feet?
Yeah.
So,
and there are other settings as well, but as a minimum, that's certainly an area in which we're offering and recommending testing for people.
And so that guidance can be seen on the DocD website?
It's in the medical advisories. It's not easy to find, but it is there.
Senator, it's a good question actually, because what I think also you're getting to, Senator, is the fluidity and way that this pandemic and what we know about the virus and how we respond to the virus has evolved, and also to the degree that what resources we have to respond to the virus have evolved. And so it is important, you're right, it is important for us to continue to make those updates more prominent for the public to kind of digest. Whereas, as Dr. Berreman was saying, initially we were trying to focus in on asymptomatic testing, but as the supplies and the rates and the more we knew about the virus evolved, we're at a point now where it's essentially at a tiered level of prioritization that goes from symptomatic to exposure to other kind of community evaluation of when somebody should be tested, even if they're not symptomatic or not necessarily a direct exposure.
Well, so I'm definitely moving the goalposts on you folks. I appreciate the data presentation. Now I'm asking for more stuff, I guess. But if the medical advisory guidance were easily accessible the way a lot of the data that we have not had accessible for a long time is now as conveniently accessible as it is through your dashboard, I think would be more helpful, because Dr. Berreman, I think, you know, in responding to Senator Favela's comments earlier, you kind of made our point, which is that, yeah, there's a risk of creating public confusion by presenting data in the way you have, because we've already had questions about the way things are presented. But they need to be, the information needs to be presented in multiple mediums in order for it to be articulated by people. We just had the DOE and a conversation about SPED, and one of the requests were that we need infographics so that the parents can digest the information, right? So I am asking for more, but I appreciate what you guys have done, because it does, I think, in my mind, justify the need for it, because this was a very helpful presentation, at least for me.
Senator, if I may add, there actually is an infographic on the tiered testing that I have seen a draft of. I don't know what the timeline is for having that out, but I am hopeful that it will be out soon, so we can make sure that you're aware of that when it comes out.
Well, great. Now that we know it exists, we can ask for it.
It's still in draft.
It's okay, and Senator, I just want to say it's a valid goalpost to move for us, because it is important, and I agree, it is important for us to continue to educate the public. I mean, way back in the 50s, that's what Smokey the Bear did, and it was an easy slogan, you know, only you can prevent forest fires. It's kind of the same thing with COVID. Everybody needs to do their part. And so you know, my commitment to you guys is to continue to push that out and to the degree that we possibly can.
Eddie, I want to go back to your notes and sources. I think it would be helpful to have a definition, going back to the cluster, the modes of transmission. Without a definition of what it is, I think it does lead to confusion, and we may make our own assumptions about what it is. That it would be helpful in your notes to say what that actually is, or, you know, a definition. And the sources, so that we know, because these are data. But if you're going to do analysis and do more infographics and so on, that's helpful as well. But as a source of data, I think it's really good to have that, so that anyone who looks at it will know the source and what it means in analyzing it. So that would be helpful, especially on the clusters, because that's what everybody's looking for. And if in fact, as Dr. Berreman says, the 3,000 are in community spread, it's one or two people in the community, even knowing where it is, in county, or, you know, some more granularity of the community would be helpful as well.
Thank you, Senator. Yeah, we're moving towards that, and in fact, and Dr. Fan can talk about this a little bit more. But the one of the goalposts is that this board starts to become interactive. And Dr. Fan and her team are working really, really hard to get it to that space, and it should be there soon.
The other thing is on the top of your dashboard, which is what we've been asking Haima and the governor for, is the triggers for, and this is more work, but this is, you have the data, which is really a great start. But this is the triggers for the zones, like the stay at home to the new normal. You have it at the top there with the reds and the orange, you know, the zones. So I don't know what the standard is or trigger is, but using the data, there should be some way looking forward, an analysis of what those triggers might be, and the data could very well give us that kind of information in these various zones of when we should close, when should open, and when it's the new normal, whatever. It might be helpful for the analysis of your committee to look at that big picture wise, not on these data immediately, but at least if you're collecting the data, we know which data to look at in doing that analysis.
I couldn't agree with you more, Senator. And again, the you know, what's the point in us doing all this work if we can only look at the information and not use the information? So if we can get to the point where the data tells us, not only tells us what's going on, but also tells us what to do about it, or what the best thing to do about it is. That's really the ultimate goal, and that's what we're working towards. I can tell you, and I think from your experience too, I know, Senator, it's no easy task, but it's one that we're undertaking willingly.
Well, thank you very much, because just having the data in one place and being able to start doing that is a really big first step. So thank you all.
Thank you, Eddie. And then to complete the picture, the data and the graphics tell us a pretty good story. I think having the dashboard is wonderful, but the general public is not seeing this or hearing this. Yeah. There has to be a communication plan, and whether it's you guys, whether it's the Department of Health, whoever. I don't know if you guys have discussed this, but I'll give you a good example. I don't know how many of you saw this. I believe it was yesterday, Eddie. This was the story that you did at the Waikiki Pearl. I don't think many people knew that we were doing this and the reason that we were doing this. Mm-hmm. Now, if you take that information, and if we had done something similar, say at Dole School, about the 6 COVID cases and what it means and why it's imperative that everybody that's associated with anybody in that school make sure you wear your mask, social distance, come forward and say, you know, you need to be tested. I think those kinds of things would go a long way in helping the public, because everybody who's out there not listening to social distancing, not wearing their mask, it's because they believe that all their friends around them are never going to be COVID positive because they're all too cool. And and we know that it's that group from 20 to 40 now. There's 2 groups, you know, that are having the most cases or the most passing the COVID virus. So I think part of what's really missing in this whole picture now is the communication, exactly what we're learning today. And we've been doing this, I don't know, 5 months now? Mm-hmm. But, you know, the pieces of the puzzle just all come together when you look at and you read this chart. Thanks to Dr. Fan and all of you that are doing this for our benefit. I would love to see a way that we can simply put it out to the community on TV or whatever. And we have COVID money that has to be expended by the end of the year. So, you know, we shouldn't be hoarding the money, but we need to do a better job of communicating what's on this chart.
Thank you.
It's a good point, Senator. We've part of what we're excited about is that people are starting to recognize it, and then we're also folks that are doing other data kind of analysis are we're starting to interface with them. So I think that helps to spread the word. And I think, like you said, we probably could do some more like social media and kind of get the word out there that data is there as well.
Yeah, and I was very appreciative of, I guess he was the vice president of the hotel. I think you
Yes.
said that it was stated that there are 4 or 5 hotels being used, but this was the only person that was willing to come forward and let the public know that yes, they are being used as a quarantine hotel, and why it was important to do so. But that was just such a great message. And I think it gave people hope that when we do things like this, we can get this back under control. So I really want to say thank you, Eddie, Dr. Berreman, and Dr. Fan for your participation today.
Thank you, Senator. Thank you, Senators.
Thank you. Aloha. Thank you very much. Thanks for joining us. Meeting's adjourned.
Thank you, guys.